This powder stops sciatic nerve pain, 3 ingredients ground together. Taken every single morning on an empty stomach before anything else, and the combination of compounds inside this powder: gamma-tocopherol from pistachios, lauric acid from coconut, and the mineral-rich natural glucose of rock sugar, targets sciatic nerve inflammation from 3 separate directions simultaneously. No single ingredient alone produces this effect. The combination is the mechanism. Pistachios protect the myelin sheath. Coconut reduces the inflammatory cytokines surrounding the nerve. Rock sugar acts as the delivery vehicle, driving the fat-soluble anti-inflammatory compounds across the nerve cell membrane where they can actually work. Today I'm showing you the exact ratio, the exact preparation, and the exact science behind every ingredient. And the seniors who try this consistently for 7 mornings report a shift in their sciatic pain that nothing else in their routine has produced. Subscribe right now and drop your age and city below. I read every single comment. Stay with me. The exact recipe and ratio is coming. Welcome back. I am Dr. Michael Kent, and this channel is for seniors over 60 who want real answers for real pain. Today we are talking about a morning powder. 3 ingredients that most American seniors already know: pistachios, crushed coconut, rock sugar, combined in a specific ratio, ground into a powder, taken on an empty stomach every single morning. This is not a new discovery. This combination has been used across South Asia and the Middle East for generations, specifically for nerve pain, burning legs, and lower back conditions. What is new is that modern nutrition research has now identified exactly why it works. And once you understand why, you will never skip a morning. But before the recipe, you need to understand one thing about why the empty stomach timing is not optional. Because most people who try this get it wrong, and that one mistake cuts the benefit by more than half. Every ingredient in this powder contains fat-soluble compounds. Fat-soluble means they need specific conditions to be absorbed properly. On an empty stomach, your digestive system is primed. No competing food. No conflicting digestive chemistry. The compounds absorb directly and rapidly into the bloodstream, and they reach the inflamed tissue surrounding the sciatic nerve within 30 minutes of consumption. Take this powder with breakfast or after coffee, and you get a fraction of that absorption. Empty stomach before water, before coffee, before anything. That is the rule. That is the entire foundation of why this powder works. Ingredient 1, pistachios. Pistachios are not just a snack. For sciatic nerve health, they are one of the most targeted natural foods available. Pistachios are extraordinarily rich in gamma-tocopherol, a specific form of vitamin E. And gamma-tocopherol does something for the sciatic nerve that most supplements cannot match. It protects the myelin sheath, the protective coating surrounding every sciatic nerve fiber, from the oxidative damage that chronic inflammation produces. When myelin is protected, nerve signals travel accurately. When myelin is damaged, those signals become erratic, amplified, and painful. The burning, the shooting, the electric quality of sciatica, all of it worsens as myelin degrades. Pistachios, consumed daily, deliver gamma-tocopherol directly to the nerve tissue, slowing that degradation, supporting the repair of myelin that has already been damaged. But here is what makes pistachios unique compared to other nuts for sciatica, and why almonds, walnuts, or cashews do not produce the same effect. The specific form of vitamin E matters enormously. Stay with me. Most vitamin E supplements contain alpha-tocopherol, the most common form. Alpha-tocopherol is beneficial for general antioxidant activity. But gamma-tocopherol, the form dominant in pistachios, specifically neutralizes the reactive nitrogen species that are most damaging to peripheral nerve tissue. These reactive nitrogen species are produced in high quantities in chronically inflamed sciatic nerve tissue, and alpha-tocopherol, despite being the most common vitamin E form, does not neutralize them effectively. Gamma-tocopherol does. This is why pistachios, not almonds, not walnuts, are the correct nut for this powder. They contain the right form of vitamin E for sciatic nerve protection. Additionally, pistachios contain lutein and zeaxanthin, antioxidants that cross the blood-nerve barrier and directly protect nerve fiber integrity. And they provide magnesium, the mineral that regulates the NMDA pain receptor, reducing the amplification of pain signals that makes chronic sciatica so intense. One ingredient, three separate nerve protective mechanisms. Ingredient 2, crushed coconut, desiccated or fresh. Most people think of coconut as a food or a flavor. What it actually does to the inflammatory cytokines surrounding the sciatic nerve on an empty stomach is something completely different. This is the ingredient that makes the combination work. Crushed coconut, whether fresh grated or desiccated, contains lauric acid as its primary fatty acid. Lauric acid is a medium-chain fatty acid with one specific property that makes it uniquely valuable for sciatic nerve inflammation. It is one of the few dietary fatty acids that directly inhibits the production of interleukin-6 and tumor necrosis factor alpha, the two primary inflammatory cytokines that surround and sensitize the sciatic nerve. When these cytokines are suppressed, the nerve becomes less sensitized, the burning reduces. The shooting pain becomes less frequent. The baseline aching that defines every day with sciatica begins to lower. Coconut also contains medium-chain triglycerides, MCTs, that are rapidly absorbed on an empty stomach and converted directly into cellular energy. For peripheral nerve cells, which have extremely high energy demands, this immediate MCT fuel supports the cellular machinery responsible for nerve repair and myelin maintenance. A nerve cell with adequate energy repairs faster. A nerve cell starved of energy deteriorates. The MCTs in coconut ensure that the nerve cells along the sciatic pathway have the fuel they need at the exact moment on an empty stomach when that fuel is absorbed most efficiently. Use unsweetened desiccated coconut, finely shredded, for the powder, or fresh coconut, grated and dried, not coconut flour, not coconut milk powder, crushed or desiccated unsweetened coconut specifically. Ingredient 3, rock sugar. This is the ingredient that surprises people the most, because most people, when they hear sugar, assume it is simply for taste. Rock sugar is not ordinary sugar, and its role in this powder is not simply flavor. Rock sugar does something in this combination that no other sweetener can replicate, and it is the reason this powder is taken on an empty stomach, not after meals. The mechanism is specific and it changes everything about how the other two ingredients work. Rock sugar contains natural glucose, trace minerals, and small amounts of naturally occurring compounds that refined white sugar has lost entirely through processing. In the context of this morning powder, rock sugar serves three specific purposes. The first is palatability. The combination of ground pistachios and desiccated coconut has a mild, slightly savory flavor. Rock sugar makes it genuinely pleasant to consume every morning, which matters because consistency is everything. A powder you skip because it tastes unpleasant produces zero results. A powder you take every morning because it tastes good compounds its benefit day after day. The second purpose is absorption enhancement. Natural glucose from rock sugar creates a brief, mild insulin response on an empty stomach. That insulin signal temporarily increases cellular membrane permeability, allowing the fat-soluble compounds from pistachios and coconut to cross into nerve cells more efficiently. Think of rock sugar as opening the door, and the pistachio and coconut compounds as what walks through it. The third purpose is nerve fuel. The nervous system runs on glucose. First thing in the morning, after 8 hours without food, blood glucose is at its overnight baseline. The natural glucose from rock sugar provides an immediate, gentle fuel source for nerve cells, supporting the cellular energy that nerve repair and anti-inflammatory processes depend on. Use authentic large crystal rock sugar, not refined white sugar, not brown sugar, not artificial sweetener. Rock sugar is available at Indian grocery stores, Middle Eastern markets, and online across the United States. The unrefined mineral content and natural crystalline structure of authentic rock sugar is what makes it functionally different from any substitute. The exact recipe, ratio, and preparation. Most people who try this powder use the wrong ratio. Too much rock sugar and the absorption benefit is lost. Too little coconut and the anti-inflammatory effect is insufficient. The ratio is specific, and it matters. The research-supported ratio for this morning powder is 2 parts pistachios, 1 part crushed coconut, 1 part rock sugar. For a single week's supply, prepare the following batch: 4 tablespoons of raw, unsalted pistachios, 2 tablespoons of unsweetened desiccated coconut, 2 tablespoons of rock sugar, crushed or finely ground. Preparation steps. Step 1. Grind the pistachios in a dry blender or coffee grinder until they reach a coarse powder consistency. Do not overgrind to a paste. A coarse powder is ideal. The natural oils in the pistachios must remain in the powder, not released into a butter consistency. Step 2. Add the desiccated coconut to the ground pistachios. Pulse together 3 to 4 times to combine. Step 3. Crush the rock sugar separately using a mortar and pestle or the back of a spoon until it is a fine powder. Add to the pistachio and coconut mixture. Mix thoroughly by hand or with a dry spoon. Step 4. Store in a clean, dry glass jar with a tight-fitting lid. Keep at room temperature away from direct sunlight. Use within 10 days for maximum freshness and potency. Daily serving, 1 heaped teaspoon, approximately 8 to 10 grams every morning. Place directly on the tongue, allow to dissolve slowly or chew gently and swallow. Do not mix into water, milk, or any other liquid. Do not eat or drink anything for 15 to 20 minutes after consuming. The dry powder consumed directly on an empty stomach, with nothing following for 15 minutes, produces the maximum absorption window for all 3 ingredients. This is not negotiable. The empty stomach, the dry consumption, the 15-minute wait. These 3 conditions together are what make this powder work. Change any one of them, and the results change significantly. Why morning? Why empty stomach? Why this specific window? The morning empty stomach window is not just about absorption. There is a second reason that's specific to sciatica. Why this timing produces results that taking the same powder at any other time of day does not. This is the part most people never hear. In the early morning hours, cortisol, your body's natural anti-inflammatory hormone, begins to rise. It peaks between 6 and 8 in the morning. This cortisol rise is your body's natural preparation for the day's physical demands. And here is what makes it so relevant to this powder. Cortisol's anti-inflammatory action works synergistically with the anti-inflammatory compounds in the powder. Consuming the powder on an empty stomach, at the exact moment cortisol is naturally rising, means the lauric acid from coconut, the gamma-tocopherol from pistachios, and the nerve fuel from rock sugar enter the bloodstream. At the same time, cortisol is performing its own anti-inflammatory work. 2 anti-inflammatory mechanisms working simultaneously at the peak window. The result is greater than either would produce alone. Miss the morning window, take the powder at noon, at dinner, before bed, and you lose this cortisol synergy entirely. The morning is not a preference. The morning is the mechanism. What to expect? Day by day, day 1 through day 3, the compounds are beginning to accumulate in the nerve tissue. Most people notice improved energy in the morning, a direct result of the MCTs from coconut providing immediate cellular fuel on an empty stomach. Sciatica changes are subtle at this stage. The gamma-tocopherol is beginning to reach the myelin tissue E. The lauric acid is beginning to reduce cytokine production. Stay consistent, do not judge results yet, day 4 through day 7. This is where most seniors begin to notice the first real shift. The baseline burning, the constant low-level irritation that is always present, often begins to reduce in intensity during this window. Morning stiffness, the first steps out of bed, frequently improves. The electric shooting quality of sciatic pain, the worst episodes, become less frequent. Not gone, less frequent. That reduction in frequency is the nerve becoming less sensitized. That is the powder working, week 2 through week 4. Consistent daily use over 2 to 4 weeks produces cumulative results. The myelin protection from gamma-tocopherol is now established as a daily baseline. The cytokine suppression from lauric acid is consistent and sustained. Most seniors report that by week 3, their worst daily pain episodes have reduced meaningfully in both intensity and duration. And the powder has become a morning habit so natural that missing it feels wrong. That is the goal. Not a treatment you take until you feel better. A daily habit that keeps the nerve calm every morning for as long as you maintain it. And here is what happens if you stop after 7 days, because most people do not realize this. The compounds stop accumulating. The cytokine suppression reverses within days. The myelin protection reduces. 7 days is where it starts, not where it ends. Stay consistent. 3 things that make this powder more effective. 1. Drink warm water with lemon 30 minutes after the powder. Not immediately after. 30 minutes after the 15-minute absorption window has passed. Warm lemon water stimulates bile flow, which further enhances the absorption of the fat-soluble compounds already circulating from the powder. It also adds vitamin C, which synergizes with gamma-tocopherol to extend its antioxidant activity in the nerve tissue. 2. Avoid coffee for at least 30 minutes after the powder. Caffeine constricts blood vessels temporarily after consumption, reducing the circulation that carries the powder's compounds to the sciatic nerve tissue. 30 minutes between the powder and the first coffee allows the compounds to reach the nerve tissue before caffeine-induced vasoconstriction reduces their delivery. 3. Take the powder at the same time every morning. Circadian biology is consistent. The cortisol rise that synergizes with the powder happens at a predictable window approximately 30 to 60 minutes after waking. Taking the powder within this window, every morning, without variation, produces the most consistent overlap between the cortisol anti-inflammatory peak and the powder's compounds. Vary the timing day to day, and you hit the window sometimes and miss it others. Consistency of timing is part of the protocol. 3 common mistakes that reduce the results. These 3 mistakes are the reason most people who try this powder do not get the full benefit. Check which ones you might make before you start. Mistake 1. Using salted or roasted pistachios. Roasting damages the gamma-tocopherol in pistachios, reducing its potency significantly. Salt adds sodium that competes with the mineral compounds of rock sugar in the absorption process. Raw, unsalted pistachios only. Non-negotiable. Mistake 2. Using sweetened coconut. Sweetened desiccated coconut contains added refined sugar that interferes with the insulin response from rock sugar, creating a competing glucose signal that disrupts the absorption enhancement mechanism. Unsweetened desiccated coconut only. Mistake 3. Taking it with warm milk or any liquid. Many people assume warm milk with the powder would enhance it. It does the opposite. Milk proteins bind to the fat-soluble compounds in pistachios and coconut, creating complexes that the gut absorbs less efficiently than the free compounds in dry powder form. Dry powder on the tongue directly every time. 3 ingredients, 1 teaspoon every morning. On an empty stomach, before anything else. This is not complicated, it is not expensive, it is not time-consuming. What it is specific. The right ingredients in the right ratio at the right time in the right way. And that specificity, repeated every single morning, gives the sciatic nerve what it has been missing. Daily myelin protection from gamma-tocopherol. Daily cytokine suppression from lauric acid. Daily nerve fuel and absorption enhancement from rock sugar, starting tomorrow morning. Share this video with every senior you know who wakes up every day with sciatic nerve pain because the ingredients are affordable. The preparation takes 5 minutes once a week, and a teaspoon every morning is something everyone dealing with sciatica deserves to try. Subscribe right now and drop your age and city in the comments. Are you going to try this tomorrow morning? Tell me below. I read every single one. Thank you for being here. See you in the next video. The information in this video is for educational purposes only and does not constitute medical advice, diagnosis, or treatment. Dr. Michael Kent is a health educator, and this video does not establish a doctor-patient relationship. Always consult your physician before making dietary changes. Individual results may vary. These statements have not been evaluated by the FDA. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Kiwi contains latex-related compounds. Those with latex allergies should consult their healthcare provider before consuming kiwi regularly. Kiwi may interact with blood-thinning medications due to its vitamin K content. Consult your healthcare provider if you take warfarin or similar medications. Always consult your healthcare provider before making significant dietary changes. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.